Your permission to use this video for educational purpose and on internet.
Yes, of course.
So tell me about your symptoms before the surgery. What were your symptoms?
I had localized pain in my thoracic spine, and it's been going on since I was about 15.
How long, since you were 15? How old are you now?
I'm 25.
Okay, so 10 years.
Yep.
How did it start?
It started out kind of small and then just gradually got worse and worse, more
Did
trouble
you have,
sitting.
Did you have any accident, any injury or any kind? So it just got, but you were doing some sport, right?
Yep, I was a 3-sport athlete until I quit my senior year from
Yeah,
pain.
you quit the sport because of this,
Yep.
right? So it really changed your life.
Mm-hmm.
For 10 years, how did you manage this pain for 10 years?
Pain management, I've been on and off a lot of painkillers and muscle relaxers, all stuff like that.
Okay, and how were they doing for you?
Not good.
Not good. And how was your work life like?
Tough. I gave up a lot of shifts, or I didn't do anything after I got off work because I was so tired.
So, and this is nothing unusual that we hear that the pain literally dictates your life.
Mm-hmm.
Especially in your case, you had a very complicated situation because your problem was in your chest.
Yeah.
We surgeons are used to deal with lots of lumbar spine, but thoracic spine is a little more difficult to deal with. Tell me about. I'm sure you saw some surgeons, some doctors, and what did they tell you? And
A lot of them didn't know what. It's like they just racked it up as chronic pain, and that there was nothing to do for it for me.
now you don't look like a chronic pain patient to me. You look like somebody who has really a problem.
Yeah.
So, did anybody look at your thoracic spine and tell you what's going on?
Mm-mm.
Okay. We looked at many films, but we noticed that in the lower lumbar spine, there is a disc that looked different. As a matter of fact, part of the bone was indenting into the bone.
Okay.
And we noticed that, that disc is not normal, but we didn't just rely on that. We did a discogram.
Yep.
Do you remember that discogram?
I do.
We pressurized 3 discs.
Mm-hmm.
Do you tell me, what did you feel when we were pressurizing those discs?
The only one I really noticed was the one that was flat. I jumped awake from it.
Yeah, so the one provoked your usual pain, whereas the other two, you probably felt just some pressure
Yeah,
and
just
no
something.
pain, right?
No pain. Yep.
And we have the result of that. And the CAT scan showed as well that one disc, literally, it doesn't hold the pressure inside. The pressure goes outside, push on the nerve, and that would completely explain your situation.
Yeah.
So you had an organic problem. Now, we discussed the options and we talked about the open versus minimal invasive surgery. What do you remember about that conversation that we had?
You told me about the option where they take out my ribs and go in that way. And
That's the open old-fashioned surgery,
Yep, and
yes.
you said that most people wouldn't touch me because of my age. And
Yes.
You talked about this one. It seemed easy to decide to do this
Yeah,
one.
yeah, this one, what did we do?
You made an incision and went in to take the disc out, put a spacer and screwed it and fused it close beyond.
Yes, you explained it very well actually. We did a minimal invasive interbody and posterolateral fusion with this technique that the MIS DTIF, direct thoracic interbody fusion. This is a method that we invented, and our surgery, I have the record of the surgery, I just looked at it. My part was 35 minutes from
Wow.
skin to skin. And your blood loss was 24 cc, which is about 4 cc less than an ounce.
Okay.
And today is just yesterday was the surgery. Actually, surgery was yesterday. I think we finished your surgery around noonish time, right?
I
Or
think we
early
started
afternoon.
around noon and then we
Yeah.
finished around 2, I think.
So it's about a day after the surgery. How was your day today? How was the physical therapy?
So much better than yesterday. Yesterday I was in a lot of pain and today's
Yeah.
been just mild.
So you have walked.
I walked up and down stairs.
How did it go?
It was good.
Stairs?
Yep, stairs
You
was
have done
good.
stairs. Now, physical therapy telling me that you're ready to go home. Do you feel you're ready to go home?
I do.
And this is not the face of somebody who had a thoracic interbody fusion, and those people they sometimes have to spend a night or 2 or 3 in the ICU with the chest coming
Oh,
out
wow.
of their chest. So this is you are smiling, and
Yeah.
people after this kind of surgery, open old-fashioned way, they don't feel like smiling.
They don't feel like
Yeah.
smiling.
So how bad is the pain right now?
I'd say only about a 7.
7. Okay. Do you have any pain turning around the chest or going down the leg and so?
No.
Okay. So obviously it's going to be a few more days that pain slowly will get better, but just the fact that you feel you're ready to go home and physical therapy feels that you're ready to go home just one day after that thoracic fusion is a big deal.
It is a big deal.
Okay, well, thank you so much for the interview.
No
Okay.
problem.